I'm really excited to introduce today one of our colleagues who you have seen on here. She's done the MC role many times in the past when I'm not here. And so Dr. Karisa Smith is going to be talking to us today about good goodbyes and healthy transitions. She's a licensed clinical psychologist and assistant professor at the COE at Vanderbilt University Medical Center. She specializes in developmental trauma and the child welfare system with a focus on infant mental health. And she's clinically worked with traumatized individuals and families within the community mental health centers, within intensive in-home services, detention centers, the COE at Vanderbilt, and at the Tennessee Department of Children's Services. And she's committed to providing children, caregivers, and child welfare teams with evidence-based practices. And she's a phenomenal speaker. I'm really looking forward to. We've been kind of talking about this talk for a long time, and so I'm excited to see it come to fruition. So I'll turn it over to you, Dr. Smith.
Thanks so much, Caleb. I am so excited to be here with you guys today and to be able to talk around how we support kids who are moving between homes and caregivers. This talk, I was thinking about it this morning, actually started in many ways 19 years ago when I was a foster care caseworker and had my first time I had to move kids. I inherited, my first case that I inherited was a SIP set of 7. That 2 weeks in, we had to do some emergency moves from a kinship placement and move the 7 kids into different homes. And I remember sitting down with my supervisor the next day being like, how can I make sure this never happens again? That was terrible. This was miserable. And she's like, you can't. You're going to do it again. And that really started this question of like, how do we do it well? Like it did not go well with that one. And so how do I do that well as a worker? Then transitioned into a lot of the work doing across graduate school, and then when I worked with DCS and now with the Vanderbilt Center of Excellence. But there is research on what do we know about how to support kids in transitioning caregivers and how do we do that well. And it's a really complicated topic with a lot of nuance to each individual situations. So we're going to spend a lot of time today just talking through what do we know, how does this apply to work and supporting kids in many different contexts and many different types of goodbyes. As we go, please add comments, or if you need me to clarify something, put that in the chat. I'm going to save room at the end for questions and more conversations around more unique situations you might have or thoughts on how to apply this to your work. So we'll save those specific questions for the end, but put questions if they're coming up or you need clarification in the chat as we go. And as we're getting started, it'd be great to see, I recognize many of you, and so you all have a lot of expertise that you're already bringing into this, and we'd love to hear your ideas as well as we're going. If you could just introduce yourself in the chat so we know who's on today and who we're all kind of talking with and spending time with today, that would be wonderful. So we'll get started. Today, we're going to start first by kind of defining what do we mean by transitions in care and moves. We're going to discuss factors that contribute to placement instability and frequent moves. We're going to explore impacts of moves from the perspective of foster youth and from a developmental perspective on the impact of these moves. We're going to discuss trauma-informed principles to guide placement moves for children. How can we do this well? What are some guideposts for how to go about transitioning kids between caregivers? And then we're going to talk about some of the barriers that are there in the system that prevent us from doing this well, and what are some ways that we can go about engaging some of those barriers and addressing things a bit differently here. So when we talk about transitions and moves for children, there are so many reasons that kids involved in child welfare move homes and move caregivers. Some of them, of course, with the initial removal, whether that's removal into a foster home, removal to a non-custodial kinship placement, that initial removal in and of itself is a move and a transition that's there. So we know that kids are at least going to have one if they're in foster care where this has happened for them before. There's also really good reasons that kids move. We plan on kids to move for really great reasons, like getting back with their parents, finding a kinship caregiver, getting that ICPC approved so they can go live with their aunts, moving kids so that they're reunified with their siblings and back in the same home. There are lots of great reasons that we move kids. Not all moves are for negative reasons, but they're all stressful. And so we want to make sure to talk through how to go about moving them well and supporting them during that time of transition. I'll note here, we talk a lot about disruptions. And if you're familiar with the child welfare system, that word is very familiar to you. But what we mean by disruptions is an unplanned move. So a situation in which we're planning on a child to stay in a home, but for whatever reason, they have to move out of that home. They have to move, whether there's a safety issue, a health issue with a caregiver, or that it's not a good fit. The caregiver's not able to keep them in the home due to behavioral concerns. You'll hear us reference this throughout the talk today, this idea of disruptions. And that's what we mean by that. It's an unplanned move for some reason or another that's there. In the state of Tennessee, so this is Tennessee specific data, 3 years ago when I was doing this talk, I had to unfortunately say Tennessee was the worst in the nation for our placement stability. That's shifted. We've made some improvement in the data over the last 3 years, quite a bit. So across the nation and internationally, one of the metrics that's used around placements is whether there are 3 or more placements for a child. So whether a child has had 3 or more placements is how we kind of categorize placement instability. And so that number is looked at pretty closely and tracked pretty closely. And in Tennessee in 2023, what we saw in the data, if we look at the length of time in custody for kids in the state of Tennessee here, we have a little bit of a variance. So for kids in 2023 in DCS custody who had been in custody for less than a year, 33% of those kids had at least 3 placements. So that means they had at least, what was that, 4 moves. You come into custody, that's your first placement, second, third. So we're talking about 33% of the kids in custody in 2023 who'd been in custody less than a year had 3 or more placements. When we look at kids at that time who'd been in custody for a year, up to 2 years, 44% had experienced 3 or more placements. And that goes up to 62% for kids that had been in custody for over 2 years. A lot of factors go into this and what contributes to this in the ways that unique needs of kids and kids with more challenging behaviors or developmental needs kind of come into this as well. But what you see, and this is across the states, in each state, you'll see this incline. So the longer kids are in custody, the more likely they are to have placement instability. We see this number kind of go up across the board here. In Tennessee, one of our students here at the COE, I think it was back in 2023, did a kind of a dive into some research and published a paper on what we know about kind of placement stability within Tennessee, and looked and ended up having about 9,000 youth between the ages of 5 and 19 who'd had some standardized assessments done between July 2012 and June 2017. And they looked at that and found that for, if we look at an aggregate of all the kids in custody during that time, our state average, we had about, most children, 21% had 1 placement, 29% had 2, and 22% had 3 placements. The average was 2 to 3 placements for kids at that time between 2008 and 2017. So we know that our kids are experiencing moves quite a bit, and that they're moving, and they're more likely to have quite a few moves that are there. So let's look at some of the factors that contribute to frequent moves, and specifically with this placement instability idea, right? So just looking closely here at kids who are moving more often. What are factors that we know that contribute to that? And we've got a lot of really helpful research that can help us kind of parse that out and look at what some of these factors are. Most research looks at 3 different categories here. We have systemic factors that contribute to it, caregiver factors, and child factors. What we found is around 37% are related to foster family, caregiver family issues when we look at the data on that. 32% of placement instability situations are due to issues related to children, and around 24.5% when you look at some of these is related to systemic factors. And obviously that is looking across the board at lots of different states and data here, but we know that these things go hand in hand. So let's parse them out a little bit in these different domains here. So when we look at systemic factors, so factors on a larger scale within the child welfare system that we know increase the risk of placement stability for children, we've got a few different things here. We have caseworker time spent in the home. This was a really great article in 2021 by Finster's team where they really looked at caseworker caseload as well as the amount of time each month a caseworker was able to spend face to face with a child on their caseload, and found that the more time they're able to spend and the lower the caseload, the less likely those kids were to have disruptions and multiple placements and placement instability. Factors such as length of time in custody, like we just went through, the longer you are in custody, the more likely you are to have more placement instability. The number of previous placements, so these go hand in hand in a spiral that we'll kind of talk about in a little bit, but the more previous placements you've had, the more likely you are to have placement instability. A big piece as well is stipends and how much we pay our caregivers. There was a really fascinating study that looked at just increasing pay by $15 a month significantly decreased placement moves and disruptions for families, and kind of what goes into that, that there's a piece of it that they are hypothesizing that's like, hey, we're being valued for the extra work that you're doing. Obviously, you're doing more than $15 a month's worth of work in supporting a child, but that communication of value and how we're paying foster parents for the work that they're doing can have a big impact and reduce placement instability. But one of the most significant ones is a match between the level of care and support that a child needs and a home that's receiving that level of support and caregivers that are equipped to provide that level of support. That's the biggest, most consistent across all the studies when we look at this. If we have children who are placed in homes that have the supports, the tools, the training, the resources that are coming into the home and supporting them to meet that level of need that that child has, they are less likely to disrupt that placement, which makes a lot of common sense, right? If you are having children in homes that don't have the resources coming in and the resource and support and time to meet the level of need that's there, of course, we're going to see an increased rate of disruption. That's a lot where we see as well just the number and the breadth of provider homes is a big piece of this as well, that the more homes we have available, the more we're able to accurately place them in homes that are going to be a good fit for them. And we know that that reduces the risk of turnover, of disruptions for our kids. We also look at caregiver factors. So in this domain, when we look at caregivers of foster children, there are some factors linked with an increased likelihood of disruption from the home. One is the commitment to their permanency. How committed are they to this child? For kinship caregivers are much less likely to have disruptions from the home with a higher level of commitment to that child's permanency versus when foster parents come in and say they're willing to keep them temporarily and have a lower level of commitment to the permanency. One of these studies was looking at just this question of when you accepted this child, were you planning on a week, a month, a year, more than that? And that's part of what they're looking at is how much were you invested from the very beginning to that child's permanency as part of the factor that's there. We know that the number of children in the home, the more children that are in a home, the more likely there is for placement instability, that a child will be disrupted from that. Again, this is not to say that every home with many children is going to have children that disrupt from that home, but we know it's a risk factor, that if we have a child who has increased risk of placement instability, and we're putting them in a home with a lot of children, we're increasing that risk of placement instability for them. A big one as well is parenting style. When we look and research at parenting styles, we're looking across a couple of domains where we're looking at how kind of strict a parent is on a spectrum of when I say you do something, and how responsive they are to a child's needs in that, kind of their expectations and their responsivity there. And one of the categories that's most often used is what we call authoritarian parenting. And that's where you have a really high demand for adherence to rules in response to instructions with kind of low concern for what's going on for you in that moment. And let me hear you out and talk to you about that. And that parenting style, when we're over on this end of the spectrum there, is linked with a higher likelihood of disruption for kids. There's a whole range in there when we're looking at parenting. There's not a lot of data on the other end of that spectrum where we're looking at permissive parenting styles and its role in disruption. So I think that will hopefully be coming out a little bit more. But we do know the more authoritarian, the more rigid parents are in parenting styles, the more likelihood there will be of a disruption that's there. But the biggest one is this piece of perceived effectiveness. How effective a parent feels at being able to make a difference in a child's life. Can you shift behaviors when there are challenges that the child in your home is facing? Do you feel like you can help them? Do you feel like you can make a difference in that child's life? This perceived effectiveness over and over and over again is the number one factor contributing to disruptions. And it's a flag that if you work with foster families or kinship caregivers, have your ears tuned in to when you hear pieces that they feel like they're not making a difference, that nothing is helping, that nothing is really shaping and shifting this. It's one of the biggest risk factors of disruption. And we want to make sure that if we hear that, we're trying to partner, get the resources on board to really support them in building up finding things that are going to be effective for them. And being able also to tolerate a little bit of that stress. We know that our kids who have experienced trauma are going to have caregivers who feel ineffective because they're holding a lot of trauma themselves. And at the core, trauma is this loss of control, this loss of feeling effective at keeping yourself and others safe. And so when we're working and caring for kids who are carrying in a lot of that trauma into the home and into their relationships, they kind of hand that over to the caregivers of feeling ineffective, feeling out of control. So we expect on some level that there's going to be an increased level of caregivers who feel a little ineffective, feel a little bit of this feeling that's there. We want to support them in being prepared for that, being able to tolerate a little bit of that. But more than that, we also want to be really equipping them to find things, to partner with them in finding what's needed for this unique child with these unique needs that are there to make it more effective and to increase that piece for them. There's also this perception of how supportive the child welfare system is a huge one, of feeling related to how often and how much time the foster care worker spends in the home, really seeing that if you feel like your team is supportive of you, you're less likely to disrupt. If you feel unsupported by the team, the increase of disruption and placement instability goes up quite a bit. Lastly here, if we're doing an overview of child factors, I'll frame this within, if you notice as we go through these are not characterological traits of children. We're looking at specific to a child and their experiences is really what this category is looking at and talking about. So for example, we know that the more adverse childhood experiences a child has had increases the risk of placement instability, the likelihood of multiple disruptions for that child. We know that age is a big one. Teens are much more likely to disrupt than younger children across the board. The rates of disruption are much higher for teens. Gender is a little bit nuanced. For the most part, boys are more likely to have placement instability than girls, with the exception of the teenage years. The teenage years, it's about equal. And interestingly, a portion of that is due to the increased number of teenage girls who self-select out of a home and say, I don't feel good in this home and I want out of this home. We see that go up in the teen years as well, and a kind of interesting pattern that's there. The types of abuse, domestic violence in some studies is linked with if you've had exposure to domestic violence in a home, you're more likely to have placement instability and multiple placements to be present there. And classically, also, if you have externalizing behaviors, so our kids who are overwhelmed and show us that they're overwhelmed and those behaviors with hyperactivity, with impulsivity, aggression, elopement, all of those types of externalizing behaviors, those are going to increase risk of placement disruption. And school difficulties is another big one. If parents are getting calls to pick up kids a lot and having challenges with kids in school, and behavioral challenges specifically, less so with academic challenges, but really behavioral challenges within school, then that increases the risk of disruption as well. So we have all of these factors, and it's not the focus of this talk to go into all of these. I could nerd out and talk with you guys about more of the nuances here for a long time, but really giving kind of that overview. There are a lot of things that go into moves and disruptions and unplanned moves and placement instability for kids. And part of how this all comes together a lot of the time in the system is something we call a disruption spiral. And what happens with this is the way sometimes these different factors keep compounding and interacting with one another to lead to a disruption spiral where we can't get a kid to land in a place long enough to get services on board to support them, and they keep disrupting. So, an example of this, and it can start in many different ways, but an example here, if you have a child who has a lot of these risk factors, multiple ACEs, externalizing behaviors, impulsivity, they have an increased risk of disruption, they experience a disruption. The disruption itself, one of the things we know, disruptions in and of themselves, whether they have these risk factors or not, will increase their likelihood of having impulsivity, hyperactivity, externalizing behaviors. So we're going to increase some of that distress, which increases the risk of disruption happening again, which leads to multiple placements, congregate care, temporary placements. And so you can get in these spirals where you have these factors that are impacting them. So then you're in a home and temporary home with lots of kids, and that increases the risk of disruption. And so now you're having multiple disruptions, and we're looking at congregate care, and you can have this way that these are impacting each other for kids. And it's really hard to sit with families, to sit with a child and try to figure out how do we interrupt this cycle, especially when the cycle is happening in sometimes chaotic, overwhelming systems where you don't have a worker that's maintained stability, or you have a system that's experiencing some under-resourcing and lots of transitions and changes. It's really hard to slow down and interrupt this spiral for kids. But it's one of the things we really want to try to do. And we'll talk through as we get in some tips for how to address some of these pieces. I have these in here, and you have the slides. I don't know if Caleb's already put the slides in the chat, but the slides will be available to you. We're not going to spend as much time on talking through systemic ways to change this and caregiver ways to change this. But if we look at all these risk factors, there are studies as well that look at how do we reduce this risk? If these are the things that increase risk, what are things that we can do to reduce placement instability, to increase placement stability for children who are involved with foster care? A lot of them here, right? So reduce worker turnover, reduce worker caseload, make sure we're placing them and assessing them at the get-go. We're increasing the foster parent network, prioritizing kinship and committed placements, getting a lot of parenting supports that are effective on board for caregivers, increasing that network, increasing that perceived competency, reducing placements in homes with many children, especially for kids who have already had a lot of placement disruptions, and increasing access to behavioral supports that are going to be effective and helpful for kids, as well as accessing school supports to build those competencies. If you weren't able to join us last month for the webinar on educational advocacy for kids in foster care, highly encourage you to access that on our website. They do a deep dive into some of the risk factors, strength and protective factors around school changes and the ways that we can be advocating for kids to reduce the stress of that within moves in that compounding way. It's a great talk that they have. It's available on the YouTube channel for the UTCOE there. But lots of things that we can do on kind of these broader levels. But we're going to talk today about, for each kid, when we're talking about moving a child, what are things that we can practically be doing for those kids on the one-on-one. And to get there, let's talk about why this matters, right? It doesn't matter because we want to reduce Tennessee's statistics and have, more placement stability on a statistical level. That's not why anybody cares about placements and placement instability. It matters because we care about kids, and we want kids to have the support that they need. We want them to have stability. And so we're going to dive a little bit in here into why this is such an important concept. And the main reason is all moves entail loss. Whether we're moving kids for positive reasons or for challenging reasons and placement instability reasons, that's the strongest theme when we look at interviews and qualitative data on kids who've experienced loss is profound loss. That they experience this as a loss of a favorite corner in the room, a loss of a friend at school that they were excited to see. The strongest theme across the board when children move is loss. And on a developmentally typical level, we experience this with moves with kids who aren't in foster care, right? When we moved to Tennessee 10 years ago, my kids were 4 and 5. We were moving for wonderful reasons. We had a lot of great resources on board. And it was a really sad time for them to leave. There was a lot of loss of their best friends across the street. and their room with the bunk bed and all of those things. On a basic level, moves entail loss. This is a really wonderful study. Ruth Chambers has done a few studies, and I'm going to highlight some quotes from these. And the resource for this is in the end if you want to access some of her articles on your own. But essentially, she is talking with people who have been in foster care, who are now adults, and she's done a lot of interviews with them. And within those interviews, she's asking about a lot of things. But part of the data she's looked at is specifically around transitions in care and moves and moving foster homes. And she has a couple of really helpful studies. And I'm going to go through a few of the quotes because I think more than the data, more than other things, hearing from a little bit of what's the perspective of how this impacted the children, how this impacted them as they're becoming adults, is a really helpful piece to look at. So here, these are all pseudonyms, of course, but here, Carmen, who was a 22-year-old and had 32 placements during their time in foster care, never had a return home, had the quote of, "You lose friends easy because in foster care, you just kind of drift away." Henry, who had 33 placements and one return home, "I felt like I was a piece of luggage or a piece of property. It's like you're getting picked up like somebody's luggage when your caseworker comes out. You're a burden. I'm just going to pick you up and drop you off at this place." It's one of the reasons, as we listen to this quote and kind of Henry's description here, that we do try to shift our language, and it's really hard to shift it, but from a child's placement to a child's home, a child that's moving and not a child that's disrupting, and trying to have some child-centric language within the system. I even on this talk today, I've talked about placements and placement moves. But it is a way that we distance. And a placement is something that we put an object, we place them there, and being mindful of our language and trying to center the child's experience. I think for me, part of it is a protective distancing. It's easier to talk about 20 placements, and it's harder to engage with 20 homes and 20 changes in residence that child has had, as well as just the system ease of having a shared language to talk about placements within a system. But this idea of feeling like a piece of property that's there. Anna, who had 32 placements, "I really wanted to stay in a place, and they didn't tell me why they were moving me. They just came in my school and took me out, and that bothered me a lot." And so with Chambers' first study here, one of her primary takeaways was moving during their adolescence taught them that relationships will not last. People are untrustworthy, and becoming close to someone is emotionally risky. And they described lacking close, trusting relationships in adulthood, including with family members, friends, and romantic partners. And when we take a look at this idea, right, of kind of the impact, the felt impact of multiple moves and placement and stability on kids, that's there. There have been a few studies that have looked at this from the perspective of young adolescents or young adults who come out of foster care, and pretty consistently are finding this theme that when we look at the felt effect of moves, it's not just that a couple of people say the quotes that we just went through, it's that the overwhelming majority of them have themes of feeling devalued, of feeling dehumanized, of feeling out of control and unsafe, and feeling detached. And as we look at this, it's trauma, right? That there's this re-traumatization that's happening in a sense at the core of some of this impact, where they're feeling the loss of humanity, the loss of value, and feeling out of control and unsafe. And this is what, when we look at this, we're like, how do we do this differently? If we can go about supporting kids, and if we can learn from some of the things that are contributing to this, is there a way that we can go about providing more support to prevent this felt effect from parts of the system that we're involved with, and parts of the places that we're interacting with kids in particular? Now, when I look at these studies and I look at some of the ways of the felt effects of these moves, as somebody who comes from a developmental psychopathology framework with attachment really as like kind of a core piece of my way of understanding relationships and development here, what stands out to me is that this tracks. This makes a lot of sense theoretically, that we're seeing kids and young adults who are feeling this way. Because we know that across development, across early childhood, middle childhood, adolescence, children are learning in relationships. They are soaking up information about who they are and what the world is. Then they're doing that through their relationships and how others respond to them and treat them. We call that an internal working model, where you're developing over time and in these interactions this sense of self, of who you are, who other people are, and what the world is like. And so constantly, these are the underpinnings, by the way, of attachment. And so when we talk about secure attachment and insecure attachment, this piece of across development, children are learning, who am I? Am I worthy of love? And will others be there when I need them? That's what children are learning in relationships. That's part of what we look at in how relationships and attachment relationships develop as secure or insecure otherwise. But this is a primary task of development, that children are learning these messages. Who am I? Identity. Am I worthy of love? Can I have connection, trust? Will others be there when I need them, and have that trust that's there? And so when we are moving children and we have multiple disruptions and we get kids caught up in the ease of moving them, and not the ease, that's the wrong way to say that. It happens so much within child welfare, it becomes more of this rote practice that happens. That we're actively answering these questions for them, that children are growing up and hearing answers to the question of who am I? Am I worthy of love? And can I trust you that you're going to prepare me for what's coming ahead for me? And the way we move children, the way we say goodbye, the way we end relationships is actively communicating to them things that they're learning about who they are and who the world is and who they can trust. So one of the things to highlight here is that we often view, this is not the end of the talk, I paused there as if it was, this is not the end of the talk, but we often view goodbyes with one caregiver as if it's the end. We're into the book, this child's moving on to go into their next relationship. We're closing this off, it's the end. The reality is goodbyes are not the end for the child. It's the next, maybe the end of the chapter, but that story and their relational continuity is continuing from one chapter to the next. We can't abruptly end with messages of, you can't trust that we're going to tell you what to expect. You can't trust that we're going to communicate value to you, and end a chapter on that, and then suddenly pick up the next chapter in the relationship with trust and value. We have to view how children are saying goodbye within this part of the story of how they're learning about themselves, how they're learning about how to connect to other people. Can I trust caregivers? What am I bringing into this? And so we want to view moves from one home to another, from one caregiver to another, whether they are for wonderful supportive reasons of returning home or for really challenging reasons of this kid can't stay in the home anymore because of safety issues that came up. Whatever the reasons that are there, what we want to come at this through is an approach of connecting them into this next chapter as part of the story of how we're building them up to be able to, even when things are hard, have what's communicated to them be you're valued. You can trust that people are going to show up for you and prepare you, and learn that you are loved and cared for. Part of the reason this comes up so often, and how we transition in kids not being told, is a big one. And it came up, and Chambers had a later study here in 2021 with a group of people looking at placements and changes. And these are recommendations. One of the questions they were asked is, what advice would you give to kids in foster care? And so some of the examples that they had were, don't become too attached to anybody. That sounds bad, but it's true. Otherwise, it's going to hurt when you move, right? So don't trust is part of the message that's there to protect yourself. There's no way to handle it. You just got to do it. I'm saying there's nothing you can do about it. This sense of lack of efficacy, the lack of being able to have a role or empowerment in that. Don't put your trust in the system or your social worker. The social workers get changed all the time. You open yourself up to get hurt. So don't expect to be in one spot. Expect the change. Expect the move. Don't expect stability. And I know, so these are really specific situations for people who had an overwhelming number of placements that are there. It's not representative of every child in foster care. I don't want to make that come off as if this is what we know for every child in foster care. But I do think it is the overwhelming theme of multiple studies who are sitting with people who've experienced multiple moves, of this piece of don't trust, protect yourself. Like, there's nothing you can do, just go along with the ride around this. And I think we as a system have been a part of perpetuating some of that for kids. And I think there are ways that we can be intentional to try to shift this for kids that we're working with and give them a different experience that isn't communicating these messages over and over again here. So let's get into actually, what do we do with this? How do we have a guide for these placement moves? I started my first iteration of this years ago, kind of went through SAMHSA's trauma-informed principles and linked it to that. But it didn't really fit with the reality of what we're talking about relationally. And so this approach is really taking, what do we know across the board about the impact of developmental trauma, the importance of relationship, things that work for children through ARC, through TBRI, through NMT, CPP, all these things. What do we know are the core pieces we want to be instilling for children who are going through multiple placement moves? And when we come down to it and we try to distill it into categories here, we start always with safety, making sure we're establishing safety. Then we get into relationships, how we are supporting and using relationships, and then regulation out of those relationships, and empowerment as big pieces of this. This, as we're talking through, I hope and I imagine every single person is going to have exceptions or something exceptional that has happened to children. Hold on to those and think those through. And let's also think through the different places that you've been involved. So maybe it's a child that is going to be returning home to parents soon, or reunifying with a sibling and moving home. So we have time to plan for this, as well as these pieces that are unplanned stability changes or unplanned home moves that children are having here. Because we're trying to cover a broad thing. It's not a cookie cutter. Here are 10 easy steps to transitioning kids between placements. These are more, how can we be holding on to these threads and slowing down and incorporating them? Okay, so for safety, we always start with establishing safety, and we want to get specific. Of course, safety takes priority, so we need to be assessing if there's a safety concern that cannot be planned around and that kid needs to move for their safety, for the safety of others, that prioritizes and takes precedent on the plans. That drives the planning to establish safety and what's needed to establish safety for them and for those around them. But we also want to get really specific with teams. A lot of times with disruptions, we're afraid of the child's reaction, and we're afraid of that because we don't want them to go through that. We don't like it when we feel out of control with that child. But not all the time is a child's big feelings and reaction about finding out about a move or moving going to be something that's a safety risk. And so really getting specific as we're talking about safety. If you hear somebody say, I think if they know about this, they're not going to be safe, spend some time. Let's talk through, what are the actual safety risks that you're concerned about? Are there ways that we can provide supports to keep them safe through that process? Developing any safety plans is needed, pulling in ideally therapists and home providers and others that know that child to really work on, what do we need to do to establish safety in this situation? Sometimes the situation is, we need to get this kid out as soon as possible and now, and that's what we're prioritizing. Sometimes in our planning, it's, what is the specific concern? Can we put things in to establish safety for them, to keep them safe, to keep others safe as we're going about this plan and process of moving them? And is this really a safety issue, or is this just something that we really don't want to engage with and are kind of scared to broach with them? And using that as part of the conversation and the starting point of, when there are clear safety issues, address those and get curious. Is this a clear safety issue? What is the specific issue? Can we plan around this to make sure that we're able to walk kids through transitions in different ways? Within this category of relationships, each relationship with caregivers is teaching children about who they are and how to relate to other people. And that's a core piece that we want to make sure everybody on that child's team is aware of. Anytime we're talking about moves, planned moves, unplanned moves that are going on, we can hold that things are hard in this relationship, things are hard. Maybe there's sad feelings around this child leaving. Maybe there's angry feelings around this child leaving. We can hold the process and the need and the decision making there, but we also hold and we do not lose track of the fact that the adults on the team have a responsibility for how they are communicating to a child about who they are in this process, whether they're valued, cared for, and how can they trust people to make these decisions and to build that in for them. I'll put a word here on young children, and we're not targeted today on specific supports for young children. That is a whole nother talk that we have available online. If you scan that QR code, I'll take you to our online platform with the Vanderbilt Center of Excellence. And there's a whole couple of talks actually on how do we do this for young children who are reliant on their attachment figures for a sense of safety and security. And I encourage you, if you work with young children, listen into that one. We have some things woven in that apply to them, but it really is so important for young children in particular, whose entire sense of safety and security in the world comes from that attachment relationship. When we're moving them, we really need to have some things in mind for how to do that well. So we hold that through this as a theme, but dive into that for more focused discussion around transitioning young children. A big piece of relationships that comes up that we want to be holding in mind is how we're communicating in relationships. And we want communication to be coming from people that that child has trusted, that have been caregivers for that child. And we actually need to use words to tell kids things that are happening. We know that this is a huge part for children over and over again. The fact that they were not told about moves or were surprised about moves is something that is profoundly hurtful. When we look at research over and over again in clinical situations and other places. And unfortunately, there are times that they can't be told, whether that's because something emergent came up and that had to be moved and pulled out of school that day. And there are times that genuinely the safety risk for that child of harming themselves or harming other people is to the point that we can't tell them in advance. Those are rare occurrences, but that happens. But a lot of the time, we can tell them. Nobody wants to do it, and it's incredibly painful, and we don't know how to do it. And so it just doesn't happen in a way that's supportive of kids. But we want to make sure that we are clearly communicating with children. And one of the things that comes up often is that we don't know where they're moving, right? So maybe we know they have to move this home by this date, but network development hasn't gotten back to us on where this child's going. So we don't have an answer. We just know that tomorrow they're going to be moving to a different home. And a lot of the times, I don't have all the information, and what do I say to kids keeps us from communicating what we do know and preparing them for that. And I love this little cartoon. 0 to 3 had put it out a little while ago on one of their pages. But it's this idea that even when we don't have all of the answers, what home this is going to be, what it's going to look like, having some communication the day before, the day of, even if you haven't had a chance before then, to have a conversation around what I know is happening. I'm going to give you a heads up. And when I communicate it, I may not know all the things, but I'm going to point you towards safety cues and how I know and things I'm looking for that are going to keep you safe, and how you can also know that you're going to be safe in all of this, even when we don't have all of the answers. And practicing that on teams for specific scenarios is really helpful. We had a consult a month or so ago. We spent, probably like 20 minutes talking through how can you say this to a child? What does that look like? Let's play that out. Does that feel awkward? What are you worried about with this? Sometimes that's really hard. Sometimes the words come and you don't need as much practice, but this idea that we need to be communicating with kids, we need to be telling them what's coming and pointing them to safety is a big piece of it. And we want to do it in developmentally appropriate language. So we often will have, like for little kids, if you can use pictures of where they're going, or use a doll and a car and doll houses to play out and communicate to them that you're sleeping here and here's your bed and you're going to go over to this one and here's the bed and that's what's going to look like, to help communicate in developmentally appropriate ways for kids can be really helpful. But we do want to communicate it to them. We want to be talking to kids about what's happening to them, because what that does is it's teaching them that we are going to be preparing them for what's coming. We are not going to sideswipe them. We're going to be there. We're going to let them know what's ahead on the road and how they're going to be safe and who's going to be with them in those situations, which is incredibly, incredibly important for kids. Within relationships, the relationships between caregivers is a huge one. Whenever possible, we want the caregiver that is sending the child away and the receiving caregivers to have communication. That whatever that looks like, if it's biological parents and foster parents, if that's a foster parent to another foster parent or kinship caregiver, whenever possible, unless it is such high conflict that there can't be communication that would be helpful, then we really want active communication between the caregivers. We want these caregivers to be able to communicate back and forth about what this child needs, what works for them. They don't have to be best friends and the closest of supports for one another, but we want there to be some ability for them to communicate, even if it is communicating an info sheet or something else that's there at the bare minimum. We want the receiving caregivers, ideally, to have some participation in routines, especially for younger children, but even for adolescents. Even if it's just like, hey, you're going to be in the Norris foster home tomorrow. Miss Norris is calling in at dinner tonight so that we can chat while we're having dinner. And you can ask her any questions and she can get to see what you usually like for dinner. A little call around that way. There's some bridge that happens there. And we want this as much as possible for kids to be able to have a caregiver see what their usual routines are like. Part of this is that kids are taking their safety cues from their current caregivers. They look to their caregivers to know, is this person safe? And so when we have the opportunity for nonverbal cues and verbal cues and interaction between one caregiver to another, we are able to communicate in a really body-based way to children and to teens. Hey, this is somebody I trust. This is somebody I can have come into my home virtually or in person and learn about you and be a part of this, and that this is somebody you can trust. And that goes a long way. Sharing pictures of what that child's room will look like, routine, snacks, hygiene items, and sharing those routines. We have a document, there's a couple of documents that we'll provide within this talk as well. One of them is a document that walks through those routines because we don't even think about them, right? Like for a lot of kids, if you say, what's your child's routine? They're gonna be like, I don't know. But there are lots of ways to support that. But the goal here with relationships is to bridge that for kids, that it's not just a checklist handover, that there's caregivers who are communicating. I've learned a lot about Lila, and I'm going to tell you about Lila, and I'm going to help Lila know that she's going to be safe with you, and that you're going to be able to take care of her and know these things about her. A word on pre-placement visits. These are hugely recommended, especially important for our little kids. And I think they happen most often in child welfare when we're doing trial home visits and passes and we're getting up to this return home, but they're also equally important for transitions in foster homes, especially when there's been a primary caregiver in that role and we're transitioning from an attachment figure. But we know that pre-placement visits decrease the fear of the unknown. Child satisfaction and placement instability plummets when we have pre-placement visits in place. And it starts ideally, for best practice for this, with the child's home. So having that caregiver pop in to the home that they're already in, and being able to see that familiar location. They're meeting this new person. If it's a new pre-adoptive person or a new caregiver that's a kinship caregiver, having them come into that child's home where they're already comfortable is usually the best way, because it builds in these messages that there's someone that you can trust. We recommend in these situations that the adults just chat with each other. They don't hone in and focus in on the child, because that makes any child be like, what's happening here? But that they just start talking as adults and about their day, what's going on, chit-chatting around that. And then having ways that you can involve that new caregiver in a small task for them. Like, hey, I got to stir the sauce. Can you give Johnny his snacks while I do that? Communicates to kids that, hey, this is somebody that mom, foster mom, grandma trusts. And those go a very long way. There are a lot of barriers to these happening on the day to day for kids, but as much as possible, we know that kids' anxiety goes down, that placement stability increases, the more often we're able to slow down and have this. There's some indication that even having virtual visits now that do this is also much more helpful. I don't have the clear data on if it's as helpful as the actual visits. My hypothesis is no, that we get some benefit, we don't get the full benefit, but we don't have the data on that yet. But even that video call is better than nothing, where they can have some chat and back and forth around there. When we're talking about relationships in the actual move itself, we want to make sure that we're planning for how they're saying goodbye to relationships, and are there relationships outside of the home that are really important to them, that they could really benefit from being able to say goodbye, being able to have a youth pastor or their neighbor across the street be able to say goodbye, or a teacher that they really loved and connected with. We want to slow down and try to make space for those goodbyes and offer those. Even if the child doesn't really want to say goodbye to them, that can be a reality that's there, that they, for whatever reason, feel insecure or unsure about having an actual goodbye. Collecting a letter, collecting a voice memo, something where the adults and the people, the children who are important to that kid, have the chance to communicate, I care about you, you're valued, I'm excited for you to move on. That is an incredibly powerful thing to be able to include in this whenever we can have it, whenever we can scrape that by. Maybe it's one teacher and that's it. Maybe there haven't been a lot of good relationships. That's part of the challenge. But if we have them, having a card, a letter, a call, at the very minimum, can be really helpful. We also know it's better overall, not in every circumstance, if the sending caregivers can actually physically be the ones to take the child to the new caregivers. Obviously, there are exceptions to this in high conflict situations, or where safety is an issue, or where a caregiver can't be regulated in that interaction with the child. But in general, if you can hand off the child themselves, that is more helpful for the child. If you can stay regulated, have a plan, and be prepared to be able to hand them physically over, drop them off at the home, help them get in there. That is very helpful in what it communicates to a child, that they're cared for, that people are showing up for them in these ways. And caregivers are going to need a lot of support for that. And how do you say goodbye? And often we'll try to talk through with caregivers, have a script prepared for how you're saying goodbye. Goodbyes are hard. Does not have to be a long act 1, act 2 script. Just something that you know when it's time to go and you're crying or she's crying or you're feeling sad. What's the plan? It can be as simple as, I'm going to miss you. And I know you're going to miss us. It's time for us to go now. So excited for you in this home, and walking through that. Again, I know that there are exceptions to this, that there are times that a caregiver's own dysregulation is to the point that it's like, I can't do that for that child. I'm going to be too upset and it's going to be dysregulating for them. But if they're there, I think a lot of caregivers don't know that this is really helpful for children to be able to transition them in this way. And so supporting them and understanding that they're an important part of this process and how they say goodbye is a really important piece here. And after the move is another one. It's a huge one, actually. We often hear that we don't want to confuse children, so we want to cut off all communication. Children are not so easily confused. They are also not confused on how people communicate care. And people communicate that I was important and you care for me when you follow up after the fact and you send a card once a month, or you have a phone call once a month where you're communicating care and love to that child, that they're on your mind, that they are valuable and you care about them. Those are incredibly powerful interactions to have. And again, the confusion can come in if you're putting that person in a caregiving role again, or where they're going back and staying there in a caregiving role and coming back from a different situation. But in general, yes, there may be a little sadness when they have reminders of that loss. But what it's teaching children is I can have that sadness, I can have connection in that sadness. I can not have to push away memories of what happened to me. I can tolerate them, and I can hear that I am loved, I am cared for, and I am thought of, which is so important for children to have. So ongoing contact when possible and appropriate is incredibly helpful for children. And similarly, having memory books in the classic way, pictures of the other family available in their new home where they can have a picture that's up and they can think of them. A lot of the times, popularly, what people think when they think about trauma is we want to keep kids away from any trauma reminders and make sure that nothing upsets them, that there's nothing that might make them sad that comes up in their life. More often than not, what we're really focused on is we want this to be a part of their lives, a part of their story that they're able to look at, to name, to have as part of their ongoing narrative. And we do that by having it continually be a part that's there. Obviously, there are exceptions. If this child is very reactive to that, but if they have a picture that reminds them of that home that they left, the foster home, a memory book that's out that's part of the books that they read, whatever that looks like, is increasing some of this opportunities for them to have a consistent narrative. This is who I am. These are the people that have loved me. This is part of my story that's there, is a really important part for kids. And part of the reason it's so important to put this kind of quote that highlights it here, when a child, and this is from the second study with Chambers here, from somebody who had 13 placements, when that child is moved, if you really love that child, you should go and visit that child or spend time with that child, still, even though he's no longer with you, because you're still letting him know that he might not get it right or he might not get it right. But then they're later in life, they'll realize that person really cared about me, right? So if you go back to the ways that multiple moves tend to impact kids negatively, this sense of not being cared for, of being devalued, being dehumanized, these are things that revalue, that communicate value, that communicate shared connection and worth that we have to kind of bake into this process. Similarly, and this was a strong theme that came out, it wasn't just these two people in this saying like, hey, just at least keep contact because a new environment's going to be scary. But if they knew they still had contact with them, they'd be a lot happier. This piece of maintaining some connection when we have looked at interviews with youth who've gone through multiple moves is a really big piece. So if we move on really quickly to areas of regulation, and these go hand in hand in a lot of ways. So we're talking about relationships and communication and how to bridge relationships. We also want to be cued in to regulation that happens within those relationships. And when we're talking about regulation with disruptions, we hold in mind that the goal of regulation in disruptions is not to prevent them from having feelings. We want them to have feelings about a loss. We do not want kids that are numbed from losses, that they don't feel anything. Our goal is to ensure that they have supports for those emotions and they can feel them with support and safety and have some regulation around it. Our goal is not to make it seem like they're not losing anything and that everything's going to be fine. Our goal for them is to really support them and to show them that you can be supported when you lose things. You can be supported when you're sad because you have to say goodbye. And that's a really big piece that I think I myself, when I think back of disruptions that I've been involved in, I don't want them to feel bad because I don't want to feel bad. And so I end up in a more cheerleader stance in those moves of, it's going to be great. They have a dog there. You love dogs. This is going to be wonderful. And it's like a pep talk cheerleader stance that I've been in myself in those roles before. And I think there's a role for having like, hey, what are things that we can be looking forward to and anchoring them in some positive, safety-oriented, connection-oriented things in the future. But what we don't want is our goal in this to be, how can I minimize and prevent this child from having feelings around this? We want them to have feelings. We want them to have regulated feelings. And that begins with the adults on the team. Moves and unplanned moves in particular can bring up a lot of feelings. If you've ever been in a move where you didn't want that child to move out of your home, but they're having to move out of your home, or you can't have that child in your home anymore because it's gone so bad and you're so mad at how things have happened here. It can bring up a lot of big feelings. It can bring up a lot of feelings as a worker when you don't have the time to move another child. You just move them here. You were just sitting with people who promised they were going to be there for that kid, and now you're going to be the one picking that kid up. It can pull up a lot of feelings that are here. And that requires us to be able to acknowledge what's going on. What regulation do we need in order to be able to provide space for that kid to have their own responses, their own regulation of their emotions with that as well? And what supports can we put in place around this? Does the foster parent need some time to talk one-on-one with that child's therapist about how things went so poorly and how mad they are about it? And at the end of that, do they feel like they can say, I can show up in these ways. I can prepare for this child to transition with these routines. I can say goodbye in these ways or not. But what we want is to really support the adults on the team and being able to acknowledge this is pulling a lot of emotions. Can we be able to engage and look through what this child needs in this moment to support the child in this transition and not let the adult's emotions drive the plan and drive the move that's happening here and the reactivity that's there? And planning around it. If you have adults on the team where the regulation is so high that no matter what you're trying, we can't get some regulation on board so that that person can be a supportive goodbye, then the plan goes to how do we build in this regulation? How do we build in goodbyes in other places? Maybe another foster sibling, maybe the teacher that you know really cared about them. Can we be pulling in some goodbyes that are positive and supportive for them? But we really have to regulate our own responses there and acknowledge the fact that none of us want to be having this conversation about moving this child. And it feels really hard to be talking about this because this isn't where any of us wanted to be. And now that we're here, how are we going to be able to engage in this and prepare together? Not in a blaming game and a pointing fingers way, but let's come back to we know that how we move kids matters and how can we support one another in supporting kids in this. So regulational considerations here, the document kind of that we are providing is one. We have two that we're going to be sending. One is a kind of planning document as a team to go through together. One is more of an information handoff of routines and help caregivers think through what are the things I've learned about this child that will be really helpful for another caregiver to know about them if I'm kind of handing these things off. And so there's more details in these in some of those documents. But the idea here is we want to help them transition and bridge routines as much as possible. Yes, we know they're going to have to adjust to a new routine. Are there ways we can help bridge that? We want to be planning ahead for what they're going to need when they have big feelings. We want the caregiver to know when Thomas is sad, what does Thomas need? When Thomas gets mad, what does that look like? And how do you help him when he's mad? How do you feel connected to Lily after she's had a tantrum? How do you feel connected in play? What makes them feel seen? All of these things that we want to be communicating and sharing. Transitional objects are comfort objects, objects that communicate safety and security, a blanket, a pillow, a nightlight. I think we had one kid that had a pen. He was just a big pen, but for whatever reason, that pen was the one that like went with them everywhere and they had it. And that was the transitional object that's there. So we want to make sure that we're communicating around all of these different pieces and looking through what is this child's typical day? What are their sensory sensitivities or reactions to different situations? What are bedtime and nap time routines? I was working with a therapy case recently that's going through a move. And the foster mom wonderfully went through and took pictures of like, here's all the hygiene items that they use. Here's our after school snacks that they usually have. Here are like what it looks like at night when they go to bed. Here's a screenshot of the books we have in our home or a picture of that. These ideas of like, hey, in the day-to-day, are there things we can be handing off for caregivers so that they know what's typical and we can build in things that are familiar so that it's not just you have entirely new bath time routine expectations and everything smells different and everything feels different. And then you go to bed now at 8 o'clock instead of 6 o'clock and nothing is the same. We're to support them in transitioning to that if we can bridge it as much as possible so that we can know like, hey, okay, you usually go to bed here. In this house, we go to bed at a different time. Let's start a little bit later and get you started, but we're going to go through the same routine you would do before that you're used to. And you show us that, teach us what that routine is as you kind of go through with all of these. The goal here being reducing those surprises and the unexpected in the really small ways as much as possible. This is a screenshot of that child information sheet that really just walks through and helps people think through kind of what is the typical day, what are the things that we know about this child. There are other options, I'm sure, for these. This is not like the gold standard of what every child needs to have taken with them. It's more of a get the thought process going so that we can share expertise. You've spent X number of weeks getting to know Lila. Help us communicate what you've learned about Lila to this next person, and what they do and how that looks like for them. Had one recently, I guess a little longer ago, but the kid finally went home and was so excited to go home. But one of the things in the foster home that they'd done every Saturday was Pancake Saturday. And they'd done that for 2 years. Every Saturday was Pancake Saturday. And there were tantrums on Saturday, and mom was trying to figure out, now that this kid was back with her, like, why are Saturdays so hard? And the kid really missed Pancake Saturday. For 2 years, every Saturday was that. And so mom, as a single mom, couldn't make pancakes every Saturday, but had Lego pancakes that they were able to have and build in that regulation, because we are creatures of habit. And having that in can be really helpful to create a sense of safety, of being seen, and connection. That was a point of connection that became a point of disconnection that again became a point of connection for that child. And that's kind of the goal with these as we go through. A big part of this is empowerment through the process and asking and including kids. And I know tomorrow you're going to be headed out. Who is really important to you that you feel like you want to make sure you have time to say goodbye to? Do you want to send a letter to anybody if you don't get a chance to see them? You've had a lot of time in this home. Who is somebody that you really want to make sure you tell them how much they mean to you? We want to be modeling, this is how we share value. This is how we say goodbye to kids in ways that are helpful, and slowing that down and incorporating what they want to say, what they think is important for the new caregivers to know about them, what they think they need in placements is a really important part as well. I'm going to pick up the pace a little bit because I'm aware of timing, ironically, now that we're on our timing slide here. One of the biggest questions we get asked is when? What's the timeline? When do I tell these kids? Like, how are we talking 2 weeks, a month, a day? What does that look like? And it really depends on the age of the child, the situation, the context, the level of stress within the home. And so instead of a specific time frame, this article, it's linked in the resources there as well, was really helpful by Jessing and Cole. But they shift it from, hey, instead of what time, like when do we do this? Give us the time frame. What we want teams to be talking about together is what needs to happen. What needs to happen for this child to have a good goodbye? Who and what sequence does that need to happen? And then that will give us a sense of when do we need to be instilling these things, right? And so we know that this is a kid that's super connected to lots of different people, and they are excited about their move to go live with grandma. This is something they're looking forward to. They can know about it with a little bit more time, and they can have time to build in goodbye parties and farewells and last play dates and last fortnight hangs, whatever that looks like for them. And so you can have a longer time drawn out for them versus a child that doesn't know what's going to happen. We don't know what foster home they're going to be in. And they are like a more anxious kid that has a lot of externalizing behaviors. We're probably going to have a shorter time frame because we don't want to draw out the distress for them, but we still need to provide a space for them, assuming safety is not an issue, that they are told about this, that they're prepared about this, that they're allowed to have their reactions with a home that they're comfortable in and people that they know, that they can grieve, that they can be mad, and that they can know that we're going to be planning this for them. That might look like the day before. It might look like 2 days before, depending on the situation that's there. So there's not a specific, you have to have 36 hours of notification for this, but instead think through, like, what does this child need to say goodbye well? And to do that, what's the time frame we're looking at here? And can they tolerate not knowing during this time, or being in between for 2 days, for 3 days, for a week, and what that might look like for them? And if we think then about what gets in the way of doing this well, there are a lot of things that get in the way of doing this well. If you've been to any of our Vanderbilt COE talks, you've seen these slides probably from our wonderful Dr. John Ebert that I'm borrowing for him, because I think it highlights in our system what gets in the way of doing this well. So this is an Irish road. This is how we process information in our brains in typical processing situations here. For this, we observe something that's happening. That information is inputted into our brains. We make an interpretation of something that's happening here. We then process that information, evaluate options, and plan. So, for example, this morning I got to the office. I observed that there was no coffee when there usually is coffee. I had to make an interpretation. There's no coffee. I need this coffee. I'm processing. How am I going to get coffee? I'm evaluating my options. Do I go to Starbucks across the street? Do I tough it out? Have I had enough coffee today? Maybe I shouldn't have coffee. I'm developing a plan. How am I going to get my coffee today? And then I'm acting. For those of you waiting, I went to Starbucks. That's right across the street, and I got coffee there. That was my action that I decided on. But that's typical processing that we're doing in the day-to-day as we're making decision-making processes here. When something happens that overwhelms us, a traumatic experience, high level of stress, we take the shortcut. We don't need to think through what are our options. Do I drive to my favorite coffee shop? Do I go to Starbucks? Do I not? Do I have tea? We don't need to evaluate options when we need to react for safety's sake. Our brains are wired for shortcuts when we need them to be there. So when something happens that jeopardizes safety or stresses us, our brain goes into react. We need that. We need quick action there. Where we don't go through this whole process, evaluate and plan, we go straight to action. We've got a reaction that's there. What happens when we are in this mode all the time of stress mode is we start to close off that process. We're not using that process hardly at all. And instead of being a shortcut, that fight, flight, freeze, fold becomes the main road, the main paved road. We go straight from interpretation to reaction and react and react. What happens in our systems too that work in trauma is we develop systems that are built along this road of trauma reactions and reaction instead of systems that are really built on processing, evaluation, and planning. And so we do this on our own. We do this as teams. We do this within systems of child welfare, that oftentimes the road we're walking the most, especially around placement decisions and moves, is a systemized process that may not be the process that includes processing, evaluating options, and planning. And unfortunately, maybe one we're bringing kids on that's re-traumatizing in this path. Again, there are times that the path, again, if safety is an issue and we have to get that kid out, we're going fast and we need to be fast for that. But we still want to be really intentional of, as a team and as a system and as a caregiver, as an adult interacting with these children, of can I slow this process down so that we're processing, evaluating options for how to move this child, making plans, and not getting stuck in this re-traumatizing highway that we have in our system as we go along with this. To support that, one of the documents here for teams as you're talking through is a disruption planning document to kind of talk through this together and guide conversations with it. But I think that piece, right, if we come back, I'll come back really quickly to this. I think we're primed for this with disruptions and moves for children, because right here at the interpretation is a really negative thing that none of us want to be a part of moving a child and being a part of a loss for a child when disruptions are happening that are unplanned. That's a really hard thing to be a part of. And so our brains are also wired to avoid the things we don't want to do and engage with. And so I think we're doubly, when we're talking about disruptions, we have a lot of big reactions, a lot of big feelings. We have a system that's paved for quickness and not slowing things down and reactivity, but we also have our own protection where we don't want to slow down and help support this child in processing these negative emotions. Let's rip the Band-Aid, let's get it off, let's go. And this is kind of triply reinforced in a lot of disruption planning pieces, just to put a word in for that. And I think that part of that is why, if we're thinking about where things can go wrong, where things get stuck in the system, a big one is the fear of that child's reactions. This is the one we hear on consults probably the most often, because nobody wants to put a child through that, through a reaction of I'm having another disruption, that foster parents are saying I can't stay here, that they can't meet my needs, that I'm going to have to move. That is a really hard thing to sit with. And nobody wants to sit with a child that's going through that. That's a really hard thing to do. And it feels like you're doing something hurtful by telling them. The reality is the hurtful thing is happening. We're helping them by giving them words and having them connection and having connection with people that are there to support them with it. So one of the things we recommend, if you're afraid, if you're noticing that like nobody wants to tell this kid because of the reaction, do that safety assessment. Is this actually a safety issue, right? Like there are times the child's high level of acuity or elopement risk can't be planned around. And there are times that really that safety issue is there. But for the most part, if we slow down and think about it, we're worried they're going to scream, stomp off, yell. We're worried they're going to sob. We're worried they're going to hit something, but they can be maintained safely with supports with that. So plan for those what ifs, plan for those safety issues, consult with any providers, give time to process in a familiar environment. Again, it's so much better for kids to be able to process in the moment in a place that they feel safe in, that they have some connections in, than a place that's totally new, that smells different, that feels different, that's with strangers. So we want them to be able to support this in a place that is focusing on support instead of avoidance with that. Similarly, another one is avoidance and minimization. This one, especially if you work in child welfare, kids move all the time. Disruptions happen day after day, week after week. If you're a team leader, if you have some involvement or you're in CASA and you are on CFTMs, it feels really familiar and it becomes very something that just feels like a day-to-day thing that's happening. In reality, it's not, right? Like it's a hard thing that's happening for them, but it feels very familiar. And one of the ways we cope with that is to avoid it and to minimize it. Well, it's just another disruption. Let's go get them. Do they know that we're coming? What time? Do they have the meds? Do they have the passport? All of those things have become really rote under stress. And there are many reasons that go into that and contribute to that. But we want to be mindful of times that we're minimizing the fact that this is a move for a child and that this is going to be hard. Yes, we want them to be okay. Yes, kids are resilient. Yes, we can get them connected. But are we avoiding talking and planning and telling them because we just don't want to engage in it and we want to pretend to be in that cheerleader stance that things are going to be fine for them and that this is going to be all good for them. Another issue can be high levels of conflict in the home, whether that's disagreement, like family does not want the child to move and they are moving for different reasons, or things got really rough in the home. You have caregivers that have invested so much and done so much and are burned out and feel like they've reached the end of the rope and they're feeling terrible because they didn't want to be here. And all of those big feelings can be there. And there can be a high level of conflict in the home between the team members, between DCS, between family members around this. Again, it comes back to this piece of not letting that dictate how things are done without at least engaging in, hey, I understand this is where we're at. If we set aside for a minute how we got here and how upset you are, and we think about what John needs to transition here, can we do that? Can you meet us here and planning for this disruption and what might be helpful? Because you have a really big piece to play. I know it seems like everything's been ineffective in how you've gone about this, but this part of how you respond to them when you say goodbye can be really helpful and mean a lot. Is that something you can engage with? Maybe they can't. But we really want to, one, let them know that it matters. Give them the why. Why does it matter how you end when things have been so rough? Why does it matter how you end when you disagree with where they're headed? Give caregivers information on why this is an important piece and how we need them to be, to quote Circle of Security, that bigger, stronger, wiser piece. Unclear plans is another one in the system that comes up quite a bit. We don't know if they're going to be in a temporary placement, residential, if they're going to be in a foster home, where that foster home is going to be. Teams feel very disconnected from that a lot of the time, and they have people asking, where are they going to be, where are they going to be, and they don't know. And that's a really hard place to be at when we don't know information, all the information. It can feed into some of that avoidance too, of, well, I can't say anything then until I know. Maybe we have a date. We know they have to leave on this date, so let's talk about what we do know. Set a deadline for, regardless of how much information we have, this kid really needs to know by the day before that they're moving. So let's plan around that and how we're going to tell them what we know and what we don't know, and point them again in that information to reminders of safety for them, and consult those providers that are working with them as well. And then we also have these pieces of emergency and already done ones. There are times we have to get kids out quickly, or they are out of no control in the teams. They're out quickly because a judge ordered it, or it happened in a way that you didn't plan on. That's where we come into the after. How can we come back around? Can we have somebody from school send a letter? Can we have a neighbor send a letter? Can they have a goodbye phone call that somebody is supporting? Can they know what to expect with some of these as well? There's some great books. They're here on the slides for you to really normalize this for kids of this process of moving, so they see it's not just them, and to also give caregivers language here. How do I talk about moves? How do I have a language around this? These can be really helpful ones. And then here's some resources that we're providing in the chat as well. But if there's a consultation, the COEs are available for consultation on issues. And so if you want to dive deeper into this, or you have a case that you'd like some consultation on, ideally your providers that you're already connected with can help you with that. But also feel free to reach out to the COEs for support around that. And there's my email on there as well. So I'm mindful, and I have all the resources in there too, but sped through a lot of content and said I'd leave some time, and I'm not leaving as much time as I thought I'd want to leave. But haven't had a chance to look at the chat either. If there's anything that would be helpful to come back to talk about.
I don't think there were any burning questions necessarily in the chat. A few comments just kind of on places, noticing just how great it was, and it would be great to incorporate some of this information into some of the adoption best practices manual, and just somebody can Delamos reiterating how important it is to recognize the importance of that big goodbye from their original caregiving system. I love this presentation. I really appreciate it. I haven't seen you do this one before, so it's great for me to get to see this. There's so much good information in here, just about the importance of being thoughtful about something that I think, I don't know, having done this for a while, it's hard not to take for granted how often it happens. And I appreciate the space and time to think about this differently and think about all these different factors and the importance of it.
It's really hard. I mean, I see in the chat, like it is hard to be a part of a system where this is happening regularly, and to engage in that. And when kids are moved far away and all the things that feel out of control with that. And I think even more so, that's why that piece of, can we slow it down? Can we have adults on the team that are trying to do it differently, that are trying to instill value and care with these kids, is such an important piece. Even if the entire team isn't in agreement with certain things, are there things that you can do that can be communicating this and shifting that practice?
Yeah, I love what one person had put in the chat earlier, that they were a foster parent and they had a small photo album for the child when they did a child home placement that they would give them to take back with them to look at whenever. As like, that's such a, like, if that's part of your process as a caregiver, that you're doing that, right? It's just how helpful that must be for those kids.
Yeah, that's so wonderful to do. Just take that time, and that communicates to them that I took the time. This is something important to me. You're important, and to communicate that in a way they can take with them. I think foster parents often have some of the best ideas of ways that they've done this and ways that they've communicated value, even when things haven't gone well, and just the creativity of care that goes into that needs to be highlighted more.
Absolutely. Yeah. I appreciate you presenting this, and I appreciate everybody who came out to join us for this. I know many of you who've been back many times to this space for these talks, and I encourage you to keep coming back. I also want to reiterate, we have the survey in the chat. Please fill that out. Give us feedback, how you felt like it went, what went well, what areas we can improve, suggestions for other topics to do in the future. And also for anyone who needs a certificate of attendance, that's how you will get it. You fill out the survey and then it'll appear on the screen, and you'll need to save that. It's not going to be emailed to you. You save that certificate once it appears. There's a copy of Dr. Smith's slides in the chat, and I'll put it again in there in case anybody didn't see it. And also, we will be posting a recording of this presentation once I get around to editing it and uploading it. So whenever that happens, hopefully in the very near future. And so I hope you'll share that with colleagues, anybody who wasn't able to make it. Also, I hope people will come back and join us next month, as we're delighted to welcome one of our colleagues from North Carolina, Dr. Trip Ake, who's going to come present to us on trauma-informed suicide assessments and share some of his wisdom with us. And then just a preview, we're hoping to expand our series and bring in some more speakers from across the nation. So we're going to expand kind of a little bit beyond some of our Tennessee speakers here in upcoming months, although we'll have an announcement about that coming out once we have everything finalized on that end. But we're hoping for some exciting news on that front in the coming months. So thank you all so much for being here. Thanks again, Karisa, for your talk.
Thanks for coming, everybody.